The guests and discussions on this show are not endorsed by the show or show host. The content is provided for informational and educational purposes only. Nothing you hear is intended to substitute for medical advice, diagnosis, and/or treatment by a qualified health professional.
Welcome to Health Revolution with V, your integrative health adventure. Welcome to the Health Revolution with V show. I am so excited to have you here today. This show is all about all things integrative health, holistic health, alternative health. So if you're looking for all of those fascinating, new, amazing things that are here for our total health, then this is the show you want to be on. And I want to, if you wanted to get onto the list to learn more about the show, you can just go to eatingwithv.com and there's a sign up right there. You won't get a bunch of junk mail, I promise. You can sign up there and you'll know when the new shows are being released. And without further ado, I would like to introduce our very special guest today. This is a woman you're going to want to listen to, especially us women, but I feel like men should know this information too so they can help their women. But on the show with me today is Beth Oreo. And Beth Oreo is a doctor of physical therapy. I'm so excited to have her here. She's been a doctor of physical therapy for 28 years. She specializes in pelvic floor therapy. Originally from New Jersey, she's been living and practicing in Port St. Lucie for 27 years at the date of this recording. And she is credentialed to treat both men and women. So men, don't think that you can't go to Dr. Beth Oreo, because you can, maybe not for pelvic floor therapy, but for other things for sure. And she has an extensive orthopedic background, which is very important for specialists in pelvic floor therapy. So without further ado, let's bring on Beth. Beth, welcome to the show.
Thank you. Very happy to be here.
I am so excited to have you here. What you have to offer is such a hot topic, especially for women these days. So we definitely want to get right into the juice of it. Okay. So tell me, what is pelvic floor therapy? Explain that to us.
So pelvic floor therapy is something that has been around for a while, but is getting more and more prevalent and people are learning more about it. So I'm super happy to be here to tell you more about it. Physical therapy or pelvic floor therapy is performed by either a physical therapist or an occupational therapist. So I am a physical therapist, and it's the treatment of either the pelvic floor muscles primarily or the dysfunction of the organs and systems that pass through and live in the pelvic floor. So that would be your genital system, your urologic system, like your bladder, your gastrointestinal system, rectum, colon, all of those things. And people don't talk about those systems. You know, people get a little embarrassed about the problems that go on in those areas. But when things go wrong there, people are pretty unhappy. So,
I bet.
Yeah.
Well, tell us what are some of the symptoms? Like what would be something that they would need to contact you for? What are those symptoms?
There's a big variety of problems. And typically most people and even most medical practitioners, the first thing that comes to mind is they think of urinary incontinence, and they think of women either just having had a baby or somebody getting older and they're having urinary incontinence. And that is one of the things that we treat. But there are so many other things that we treat that nobody knows about. So things such as chronic diarrhea, chronic constipation, men who've had a prostatectomy, somebody who's had prostate cancer. So I treat men pelvic floor problems. They have pelvic floor problems just as much as women do.
Wow. See, I would not have associated that. See,
Right.
Even I had no idea.
Mm-hmm.
So the pelvic floor, it affects everybody. I'm so glad that you're giving us this information.
Yeah.
So men have those issues as well.
Sure.
Especially with, I would have never thought, like chronic diarrhea and chronic constipation.
Yeah.
Wow.
And anybody who's had any kind of colorectal cancers or uterine cancer, cervical cancer, any cancers down in the structures or around the pelvic floor region, usually those types of structures, and have had any kind of radiation. Radiation is one of those treatments that we kind of say it's the gift that keeps on giving, although it's not really a gift, but radiation causes the tissues to get tighter and tighter. So it can make it more difficult if you've had, say, colon cancer. The structures around where the radiation has been done can get tighter as time goes by. So somebody who's had radiation maybe when they were in their 40s, they might do okay and then develop problems later, 10, 15 years later, that pelvic floor can be helpful with. But it's also something that, you know, is something that they should really get right away, because an ounce of prevention is worth a pound of cure.
Oh, for sure. So if a person were actually recently, or in the last couple of years recently, had gone through any of that, anything with radiation, they could reach out to you now to avoid having an issue later.
Yes.
That might be more exacerbated at that time.
Yes.
Wow. Well, that's good information to have, because how many people go through these radiation treatments, and not necessarily just for cancers in that area. It could be cancer anywhere, right?
Yeah.
Wow.
And in fact, I was just talking to a retired OBGYN, and we were talking about it, and he had no idea that we treat all of those other problems. And he was like, wow, I never even considered that. Yeah.
Wow.
He was thinking again, just the typical urinary incontinence kind of thing. And there's just so much more to it.
Isn't that something? It's kind of like candida. When people have candida and there's so many symptoms and it goes in 100 directions and they never pinpoint it back to candida. So that's kind of the same thing with you.
Yeah.
There's a lot of different symptoms that could be related to the pelvic floor.
And it's the pelvic floor, there's so many things that are in there. So the pelvic floor supports everything that's in the abdominal cavity, all your organs, literally keeps all your insides from falling outside, which is a big deal.
The word floor, right?
Right. And it also supports your lumbar spine. So through your sacrum, attachment to your sacrum. So it's a big player in core stabilization, and it's attached to your hip and your hips and your pelvis. So it interacts with a lot of things. And then you have you have your bladder and your urethra going through there, the vaginal canal if it's a woman, the rectum. You have a lot of things going through there. And I always say, it's kind of a funny analogy to use, but I always call it the barking dog phenomenon. So if you have dogs, like more than one dog, you never see, if there's 3 dogs together, you don't see one dog barking. If one dog starts barking, they all start barking.
Yes.
And that's kind of what happens in the pelvic floor. If one structure becomes unhappy and there's a dysfunction there, if it's allowed to go on untreated for a long period of time, it spreads.
Oh, wow.
And so you wind up with other problems. So for instance, somebody who has chronic constipation, if that goes on long enough, they're going to have urinary leaking. They're going to end up with pelvic pain, and it's just going to keep this domino effect is just going to keep going on. And then they're going to the patient's just going to be going crazy thinking that, what is wrong with me? What is going on? And they're going to go from specialist to specialist, because our healthcare system doesn't treat the body as a system, treats it in little boxes, and you got to go see your colorectal doctor, and then go see urologist.
Don't
and nobody's
get me started on these doctors
and nobody's
today,
talking to each other, and the patient's going crazy, and they don't realize that their constipation was the driver for the urinary incontinence, because it's an intra-abdominal pressure problem.
Right.
Yeah.
And that makes 100% sense. So if you're having some of these crazy problems, if you have that constipation or you're having the diarrhea and other symptoms, you may want to can they get an examination, or how does that
They don't
work?
need a referral. They can most of my patients are people like that are frustrated. They've been running around to different doctors for on average like 2 years, have seen 5 doctors, been told all these different things. They're just so frustrated. They start doing their own research. Somewhere along the line, they come across pelvic floor therapy, and they say, let me check that out. They come across my website, they call, they come in. They don't have a physician referral, which is not required in the state of Florida. So they can just come in on their own, and then they tell their whole story, and they finally find someone who doesn't tell them that they're crazy, that it's all in their head, that so it's and then they find out how it does all tie together, and that they weren't just making it up or crazy.
Yeah. Well, every system in the body, like as an integrative nutrition health coach, there is so much. Our body, every system relies on every other system for a reason. You know what I mean?
Yes.
So I am so fascinated. You and I have so much more to talk about, but we have to take a quick break and listen to our local businesses that are helping to support the show. But we will be back in just a moment. Don't go away.
Beach Bowls is a family-owned and operated cafe located in beautiful downtown Fort Pierce and St. Lucie West. They offer delicious homemade smoothies, bowls, sandwiches, and salads made with fresh food from local farmers. Visit beachbowlsfortpierce.com.
This is Elaine R. Davis.
And Annette Robbins with the Real Team at ROG, Engage, and One Lux.
We are top producing real estate team on the Treasure Coast and proud supporter of V.
Contact us with any of your real estate needs or questions.
For more information, visit ElaineRDavisRealtor.com.
And let us be the key to your real life paradise.
Apex Electric is a family-owned and operated, licensed and insured electrical contractor with over 30 years of experience. No job is too big or too small. With free estimates and a 1-year warranty, Apex Electric is your premier contractor on the Treasure Coast. AAPEXElectricinc.com.
Have you been told that you need to cut way back on sugars due to a health condition? Do you find yourself struggling to give up the sugars even though you know your health depends upon it? If you answered yes, my online Hidden Sugars class is for you. Take charge of your health and visit eatingwithv.com and take the class. Welcome back to Health Revolution with V, and we are here with Beth Oreo, Doctor of Physical Therapy. So we're going to get right back to it because she has so much great information for us today. So Beth, welcome back.
Thank you.
So excited. All right, we're going to keep on going because I have a lot of questions for you. So what is the training that it would take to become a doctor of physical therapy?
So today, the entry-level degree to be a physical therapist is a doctorate. So to be a pelvic floor physical therapist, though, you need additional training. So when I went to school initially, I'm so old, they didn't even cover pelvic floor therapy initially. So now in the curriculum, they do cover pelvic floor therapy, but just kind of briefly. They just kind of go over the basics. To become a pelvic floor therapist, you really need to have several years experience in orthopedics because it does integrate so much with the lumbar spine, the bony pelvis, the hips. You need that strong orthopedic background and a good general background knowledge of physical therapy. Then you need to go on and do additional postgraduate training and credentialing to treat both males and, well, at least females and males if you want to treat males. We do treat internally because the pelvic floor is inside the body. So it is separate credentialing that has to be done that's not taught in school.
So for the woman, you would have a different training, obviously, than the man. They don't do it like a blanket pelvic floor kind of.
Right. So women can be treated either intravaginally or intrarectally, depending on where the problem is. Men obviously don't have a vagina, so it's always intrarectally if internal treatment is necessary. Internal treatment is not always necessary for everyone. Depends on what the problem is.
And how do you determine that? How do you determine which treatment, like if it's a woman, because obviously we have more than one entry point.
Sure.
So how would you determine which way? Is there special testing that you do?
So for instance, if their complaints were bladder related, you would check more likely to check vaginally. So vaginal is always like kind of the default, unless they're complaining of pain rectally. So if they're complaining of pain, they're complaining of pelvic pain and it's more rectally, like I feel like I'm sitting on a golf ball, more like towards the coccyx, or they feel, that, then you would assess more. It's just easier to get, your finger's only so long. So it's easier to get to those tissues.
Gotcha. Mm-hmm. So can you explain kind of what that treatment looks like? I mean, in general?
So assessment wise, most pelvic floor therapists prefer to always do an internal assessment, at least as a minimum, because you need to know what's happening. It's hard to define your treatment plan and accurately make a treatment plan if you haven't actually assessed the tissues that you need to treat. So internal assessment's really necessary. However, depending on the patient and what they've been going through, they may not psychologically and emotionally be ready for that. So I don't always do that right off the bat. I never require a patient to do something that they're not ready for, or I require an enthusiastic consent, not, okay, I'll do that.
Is anyone ever enthusiastic to consent?
Yeah. Patients are like, I want to get better. I don't care what it takes.
Oh, yeah.
Yes,
I've been there like
fine.
that too. But I still am like, oh no, I have to go in and get that.
It's so much less invasive and less traumatic than a gynecological exam. There's no speculum, there's no stirrups. It's not like that.
Okay.
So usually once that's explained and it's you're draped and, it's just more private. It's not like that. So, but if patients, a lot of patients are just traumatized by everything they've been through before they've gotten there. So a lot of times I don't do it on the first visit or the second visit. Sometimes it's like, hey, let's build a rapport. Let's let you get into this process and see what's, get comfortable before we do that. There's oftentimes a lot of treatment you can do, first to get started. And then, in some patients, depending on their background, they're just like, no, I can't do it. That's just, a lot of men, they're like, nope, that's an exit, not an entrance. We're not doing that. That's just, and then you meet patients where they are and you work with what you can. And I never force someone to do something they are not comfortable doing.
So you can assess them without having an internal examination if they need it.
Yeah, a good subjective history will usually tell you if the pelvic floor is either too tight or too loose and usually both. If the pelvic floor is too tight or too weak, or too floppy, they're both going to be weak. A pelvic floor that's too tight and overactive, like if it's in spasm, is also going to be weak. So weakness is always the bottom line, but you can't strengthen something in spasm.
Okay. I have some more questions and I'm sure you all want to hear too. So we're going to take one more quick break and we will be back in just a moment. Don't go away.
At Your Body Bliss, our passion is creating handcrafted bath and body products for your entire family. From our hand-poured soaps and authentic Castile soap to incredible lotions and more, all made with ethically sourced quality ingredients. With love from our family to yours, yourbodybliss.com.
The Porch Factory is the #1 screen company on the Treasure Coast. Right now, we're offering screen repair. For $99, you'll get a screen inspection twice a year and first priority service if a storm comes. Enclose it so you can use it. Visit theporchfactory.com. That's theporchfactory.com.
Is your insurance company telling you that you have to replace your roof? Nice Roofing is a family and veteran-owned and operated local business. Choose peace of mind and quality work with this Owens Corning Platinum Certified contractor. Join thousands of satisfied customers. Visit niceroofing.com. The Health Revolution with V Show is your hub for all things integrative, holistic, and natural health on the Treasure Coast. If you are in the natural health arena and would like to be on the show and or advertise with us, please visit eatingwithv.com and click Health Revolution with V. Welcome back to Health Revolution with V. We are still here with Beth Oreo. So glad to have her here, Doctor of Physical Therapy. We're talking about her pelvic floor therapies, and we're going to get right back to it because there's a lot more information and we don't want to run out of time with her. So Beth, welcome back again.
Thank you.
Another quick question I had for you. So what are the symptoms if the pelvic floor is like too loose, too weak?
So too weak can usually give people urinary symptoms like leaking. That's usually the #1 thing. But it can also give women prolapse of their bladder. So where the bladder is dropping down or the uterus is dropping down. And that will give symptoms of heaviness and feeling of like fatigue deep in the pelvis or heaviness or pain. Also, if the pelvic floor is really weak, you can get rectal prolapse where the rectum, so patients could be having difficulty having a bowel movement and feeling like they just can't, like they have to keep moving around on the toilet to, get aligned and difficulty with that and feeling like they may even have to manually assist to have a bowel movement.
Wow.
Yeah. And the parts of the body can actually come out and be outside the body. I've heard that
happening. I had a friend who that happened to. She had a bunch of surgeries. And it was terrible. And it would come out. Mm-hmm. Now, what about when it's too tight? What are those symptoms like?
Pain, pelvic pain. It can also cause leaking. So people always think leaking is just like a weak floppy bladder, but it's not always the case. An overactive pelvic floor will cause urinary leaking as well. It can also mimic all the symptoms of a urinary tract infection. So a lot of people who have chronic urinary tract infections where they're going to the doctor and they're going on antibiotics all the time, but their urinary cultures are negative. Well, it's not a urinary tract infection. It's the pelvic floor kind of clamping down on the urethra. It irritates the urethra. It sends that message back up to the bladder, and it gives the burning, the frequency, all of those symptoms of a urinary tract infection, except it's not a urinary tract infection. It's a hyperactive pelvic floor.
See, I would have never guessed that either.
Yeah, or an overactive pelvic floor.
That's amazing.
Yeah.
See, all this, I hope y'all are taking notes. I have actually been taking notes. She's got this under control. This is some great information. So, what if the doctor says that they need to have a surgery? Is that something that if they come to you early, that you might be able to help them with that?
Yes, I've had several patients who were told they needed surgery and they thought, well, I'm going to go to pelvic floor therapy as a last-ditch effort. And they came on their own and they didn't end up having surgery.
Wow.
For different prolapses, bladder prolapse, rectal prolapse. Also, even if a patient needs surgery and absolutely has to have surgery, it's always better to have therapy before and after to make the pelvic floor as strong as possible going in, and also learning what you should, the do's and don'ts before surgery. Physicians are very busy. They do not have time to educate their patients. They do surgery. If they're surgeons, they do surgery. They don't have time. They don't have people in their office as health educators.
Right.
They just don't have that. That's just not how unfortunately, our system is set up.
Nutrition's the same way.
Exactly.
They have very little training on nutrition, and so they don't know how to counsel people.
There's no education component in there, and the more patients know, the better they can take care of themselves. And a lot of surgeries in this country fail simply because patients just didn't know. They just didn't know. I didn't know I wasn't supposed to do that. I didn't know I should have done that. I just didn't know. And so when patients go in and they do a pre-surgery program and they get their, whether it's for a prostatectomy, patients that do a pre-program and strengthen their pelvic floor before they have their prostates removed recover their continence so much faster than patients who don't, and then go to pelvic floor therapy, they become continent so much faster. So whether you're having surgery for whatever it is, doesn't matter. Go to therapy before, even if it's for just one visit, and learn, hey, do these exercises, do this, don't do this, be careful after surgery, don't, and then come back and learn the most, you're going to have the best outcome.
I would have never known that.
Yeah.
Had Beth not come on here, I'd never heard of having to go for, or not having to, but the thought of going for physical therapy prior to a surgery. That's really good information for people to have.
And it used to be standard for a lot of surgeries, like orthopedic surgeries. Back in the day, we used to see total knee replacements before surgery, but then they don't cover it anymore.
That's one more question I had, was, and real quickly, do you take insurance?
I take Medicare assignment.
Okay.
Everything else, commercial insurance, is out of network. So it is covered by their insurance, but the patients have to submit back to the insurance company because insurance companies, unfortunately, don't pay for the one-on-one coverage or the one-on-one time that's required to do this type of therapy effectively. Okay.
So they would need to obviously come and pay you and then submit the bills to their insurance company.
Yes.
Okay.
But they're not seen at the frequency they're not seen 3 times a week. Some patients come when they can come, whether it's once a week, once a month, they do what they can do.
Gotcha.
Mm-hmm.
Gotcha. So it's pretty much a cash pay, but they may get reimbursed for it.
Mm-hmm. Yeah.
Gotcha. So now I guess the really important stuff is, how do they get a hold of you? Do you have any special offerings for the Health Revolution with V people? And maybe there's some special intro visit or something like that?
I do a 4-visit package for all my patients, and I give 20% off.
Wow.
Yeah, for everybody, because most people are paying cash up front. And they can go to my website, they can schedule online, and all of that is available to them.
Okay,
So,
perfect.
mhm.
And that website is Beth Oreo, like the Oreo cookie, DPT, like Dr. Physical Therapy.com. So BethOreoDPT.com. I want to thank you so much for coming on the show, Beth.
You're welcome. Thank you for having me.
And if you want to go ahead to eatingwithv.com, you can sign up to know when more shows are coming. We have so many amazing guests like Beth coming on to give you all this great information. And we will look forward to seeing you on the next show. Thanks for watching.